Congratulations! You've made a wonderful decision and you're on your way to the beautiful smile you've always wanted. We know you have many choices, so thank you for choosing Dr. Kakria. My name is Julie. I'm a registered dental hygienist, and I'm here to show you everything you need to achieve a perfect, healthy smile. Here's a bag of goodies we're going to give you, and it has everything you need in it to make your journey smooth. In your bag is a Homecare Kit. This has all of the tools you will need to keep your mouth healthy. If you need to replace any of these items, your local pharmacy will carry all of the items. Also in your bag is this booklet. It was written by Dr. Kakria, and it will also answer all of your questions. Everything I'm about to go over is in this book in detail. The last thing you'll find in your bag is a picture showing a healthy mouth and an unhealthy mouth. Someone who took great care of their teeth while they had their braces on and someone who didn't. Which smile do you want? That's easy, the clean one. In the Oral Hygiene Kit is also a toothbrush, a travel toothbrush, some floss, a proxy brush, floss threaders, and wax. The most important job you have while you have your braces on is to keep them clean. This means brushing 4 times a day. Yes, 4 times. After breakfast, after lunch, after dinner, and before you go to bed. If you're at school and you're not able to brush, it's okay. Just rinse your mouth out and brush as soon as you get home. We have a travel toothbrush included in the bag, so it's more easy for you to brush on the go. Let me show you how to brush with braces on. First thing you're going to do is you're going to start way at the back on the bottom. That means cleaning about 2 teeth at a time and cleaning underneath the bracket, on top of the bracket, and over the bracket, so to make sure you've removed everything from the area. Then you're going to move forward, doing about 2 teeth at a time, under the bracket, on top of the bracket, over the bracket, in a sequence all the way around on the outside on the bottom. Then you're going to continue on to the inside, doing the same thing, which should be easier since you don't have any braces in there. We're going to finish the bottom by scrubbing the top chewing surfaces of the teeth. Now that the bottom is finished, you're going to move on and do the exact same thing on the top. Don't forget those teeth way at the back, starting right at the very last tooth, under the bracket, over the bracket, on top of the bracket. Again, going all the way in a circuit around to the other side, cleaning the insides of the teeth where there aren't any braces, and finishing with the chewing surfaces of your teeth. The whole process is going to take 3 to 4 minutes. This isn't a quick job. If you do a good job, it'll be better than a quick job. Now that we're done brushing, we're going to need to floss our teeth. Flossing isn't as easy as it used to be, since the wires are now in the way. So we need a little tool to help us get the floss underneath the wire. This is called a floss thread. It's a little loop that we can tie the floss onto to allow us to floss with braces on. So what you do with this is you're going to take the stiffer loop, you're going to feed it underneath the wire, and now you can floss like you used to. You're going to take the floss, wiggle it in between the teeth, clean up and down the side of one tooth, turn it towards you, clean up and down the side of the other tooth, then you can pull the floss out. Now you need to repeat this process for every area where your teeth are touching. It can be very time consuming, but it's very important. If you feel like flossing like that might be difficult for you, you can consider an electric flosser. Sonicare makes one, and there's a couple of over-the-counter ones that you'll find, but we do still recommend regularly flossing a couple times a week. You also can consider using an electric toothbrush. We recommend the Sonicare or the Oral-B Triumph. It's not necessary, but it can be beneficial if you're struggling with keeping your teeth clean. Another tool in your kit is called a proxy brush. It looks like a little Christmas tree with little bristles on a handle. This was my favorite when I had braces on. It's excellent for removing food around the braces. It doesn't replace brushing or flossing, but it's excellent to have in your pocket when you're on the go. I'll show you how to use it. So you take the proxy brush and you can just slide it around the bracket, under the wire, under the bracket to remove any sort of food debris or anything that might be stuck in there. Then you can just put the little lid on it, put it in your pocket, and you have it to go. I would replace it every 2 or 3 days. I'm sure you've heard about people getting cavities with braces on or having those white spots on your teeth when the braces are finished. This is very easy to avoid if you follow our simple and easy steps that we've given you. Please take your time and make sure to do a great job to keep your teeth clean. Dr. Kakria loves clean teeth, and he knows that they move faster. Lastly, in your bag is something called orthodontic wax. It comes in a little container like this, has some strips of wax in it. The wax does a few good jobs for you. Some people need lots of wax. Some people don't need any. But if you have an area that's rough or bothersome, the wax can make a cushion between the braces and the cheek and make things more comfortable for you. Let us know if you need some more. Here's the not so fun part. Your diet will need to be modified while you have braces on. Anything that's sticky, hard, chewy is going to need to be avoided because it could bend your wires or knock off braces. Just use common sense and you'll have no problems. If you do knock off a lot of brackets and bend the wires frequently, it can add time on your treatment. You'll need to avoid hard foods, sticky foods, foods high in sugar, food with bones. Soda should also be avoided as it contributes to those white spots on the teeth. Absolutely no gum, no popcorn, no nuts, no chewing on ice, no Doritos, no lemons, no taffy, no caramels, no hard bread, and no pizza crust. These are chronic for knocking off braces. If you want to have corn on the cob, you need to take it off the cob. Chicken wings and ribs will need to come off the bone. Anything that you bite into and tear away at, like pizza, you'll now need to cut into pieces and chew on your back teeth. There's a couple foods that are really good for us that are also hard and can knock off the braces, like carrots and apples. Those items will also need to be cut and chewed on the back teeth. So let's say you do make a food choice that causes a bracket to come off. Now what? We want you to call our office right away so we can repair the problem. Or a bracket is poking you, go ahead and put some orthodontic wax on it and to give you comfort until we can fix it. A true orthodontic emergency involves bleeding or pain, and it is extremely rare. But we do want you to be comfortable at all times. So please be sure to call us if you have any problems so we can make everything better. We'll get you in as soon as possible to make you comfortable and at a close date to repair the problem. Almost all of our patients receive turbos. This is a small ramp that's placed behind the front teeth or on the back molars. They play a vital role in getting your new smile started. They do 3 big jobs for us. The first job is keeping the teeth apart a little bit so that you're more comfortable because the teeth aren't hitting each other as often. The second job they do for us is by keeping the teeth apart, the teeth have an opportunity to move more freely. And the third thing they do for us is they help you not knock off your braces when you chew while the teeth are getting started moving. They'll wear down in a few weeks and you'll be used to them in no time. Everyone gets used to their braces at a different pace. Some have a little discomfort for a couple days and some it could last for a couple weeks. We just recommend an over-the-counter pain medication to get you through the initial period. Please try to come to your scheduled appointments. We see you about every 7 to 12 weeks, so it really means very little time missed from school and work. But if you can be sure to attend your appointments, we can be sure to get your braces moving along correctly. So that's it. Be sure to ask a team member if you have any other questions. We're here to make your orthodontic experience a positive one. Braces are an investment in your future. The benefits gained from a great smile will pay off for a lifetime. We welcome you to our family, and we hope that you have a wonderful journey to a beautiful smile. Oh wait, one last thing. You see the bike we have hanging from the ceiling in our office? Well, that could be yours. Just refer your friends so that they too can have a beautiful smile. We'll put your name in a draw and you could win the bike of your choice. Good luck and keep smiling.